Hello, Karina. I am a student occupational therapy assistant. Today, I'm gonna show you some oral and motor preparatory techniques. Do you feel comfortable with me demonstrating some of these techniques with you?
Yes.
Very good. So to begin, I'm gonna demonstrate the back hold with my client. Uh, to begin this back hold, I'm gonna position the client in a slight chin tuck position, along with head in midline with good trunk support. I will also reach around her head with support of my arm on the back side of her head and my thumb here on the side with my first finger on the top lip, not blocking the nasal passages, with my second finger just below the bottom lip and my fourth finger underneath the chin. I'm going to demonstrate the walking on tongue. Just go past the middle part of the tongue and just walk it on out. I can also feed from this position, and I can also feed even with me sitting down in a chair in this position as well. For the purpose of this practicum, the abnormal tone that I have chosen is a hypertone. The intervention process that I would do would be a perioral massage. This involves firm pressure on the mouth or cheekbones in a downward motion. Or also walking on tongue. The oromotor toy of my choice to address this tone would be a banana brush or also a harmonica or a small oral motor instrument to help engage more oral stimulation of the mouth. For the purpose of this practicum, I have chosen bite reflex. To begin, I would make sure that my client's head, trunk, and chin are in the correct position in midline with the appropriate chin tuck. If a bite reflex was to occur, I would perform a technique such as stimulating other parts of the body, try to perhaps distract my client, reassure them that the situation is okay, perform a perioral massage, or hold the top part of their head, apply slight and increasing pressure underneath the chin to release the bite reflex. Hello, Karina. We're going to go over the Will-Barger brushing protocol. To first go over the Will-Barger brushing protocol, this is a deep pressure technique that we use on clients for sensory defensiveness. The purpose is to alter or normalize processing which assists with clients or students alike in the ability to function in a school, work, or social setting. To begin, I'm going to be brushing your upper right extremity. Let me just roll this up for you real quick. I'm going to apply deep, firm pressure to make sure it does not hurt or it does not tickle. Does that feel good to you, Karina?
Yes.
Good. When brushing up and down any extremity, we must make sure and ensure that the brush does not leave contact with the skin. I will continue to do this on Karina's back, on her upper left extremity, along with her legs. While I am transitioning on brushing, I will make sure that the brush does not leave any point of contact with Karina's body. I will also make sure to avoid areas such as the face, the stomach, or the groin region. After the Will-Barger brushing protocol, I will implement joint compressions. In doing so, I will demonstrate joint compressions on the upper right extremity. The purpose of the joint compressions is to give the client a proprioceptive input of these joint compressions. To begin, we're going to be doing joint compressions here on the wrist, the elbow joints, and the shoulder joints. I will do 10 joint compressions. I will transition my way to the elbow joints. And make my way up to your shoulder joints. I would do the joint compressions along with her upper left extremity and followed by with joint compressions on her lower extremities as well. Followed by the joint compressions, I will also follow up on two programming recommendations following the protocol. This usually requires lifting heavy loads or some form of heavy lifting. I would recommend lifting light weights, perhaps doing push-ups at the client's ability, along and or with jumping jacks or jumping.